Hey, hi, hello everyone. Welcome to Catchy. Shh, the secrets.
Hi friends, I'm back with one of the health related issue that we are facing. We all do know what COVID is and many of us even face how it will be. We do know how to get rid of COVID, but a new research reveals that COVID is making tinnitus more worse. Actually, what do you mean by tinnitus? Tinnitus is nothing but a patient have a perception of sound actually when there is no sound, that a person will hear some sound in your ears, and sometimes if we do have any blast around us, our ear rings for some time. This is nothing but our brain is perceiving some sound when there is actually no sound. And we do have any solution for tinnitus. It is very difficult to treat tinnitus. First of all, we need to know what is the cause for tinnitus, and then we have to undergo a hearing test whether to know our inner ear is working properly and there is no irritability in our inner ear. Once we are done with that, we have to know the severity of the sound. If the sound is very small, then the person can ignore it, and if the sound level is to certain level where which it is causing disturbance in patient's life, that is a person is not able to sleep properly, work and concentrate properly, in those cases he has to undergo a medication. And one of the major problem that people think is that they do have brain tumor, and they have to undergo MRI to rule out whether there is any tumor, because sometimes the tumor is the first sign for a person that he do have tinnitus. In that condition has to take medicines, and these medicines are only to suppress the nerves and to control the perception of sound, and then the person can lead the life normally if the medication works properly. Actually, why only COVID is making the tinnitus work? Because it is associated with reduced emotional depression and anxiety. Tinnitus has affected about 15 to 20% of people, and it is a symptom of underlying condition where it is experiencing both the external factors such as changes to daily routine of a person and internal factors such as increased anxiety, feeling of loneliness. And a research revealed that which conducted on 3000 people from 48 countries, out of which 40% of those people have experienced a worsening tinnitus condition. And we all know that social distancing measures have been introduced to control the spread of virus, but these led to significant changes to work and lifestyle routine of a person, out of which 46% from United Kingdom and 29% from North America has reported to such tinnitus condition. Actually, what is a major cause for it? Internal worries such as fear of catching COVID, financial concern, external factors such as increased number of video calls, noisier home environment, greater consumption of alcohol and coffee, and homeschoolings, which have further increased emotional distress for a person. And some of these changes by COVID-19 appears to have a negative impact on the life of a person with tinnitus. And it also proven that females and people under age 50 found that tinnitus particularly have been problematic during this pandemic situation. COVID-19 pandemic has also made it more difficult for patients to access their health care and support for their condition. If at the earlier stages tinnitus is not ruled out, or poor treatment of tinnitus in early stages often leads to much worsening cause and even initiating with severe impact on mental condition of a person. And at the same time, COVID-19 second wave has been taken place. The healthcare system needs to ensure that anyone who develops with tinnitus or experiencing the worsening situation of this condition should have the professional healthcare support, and they need to have a possible quick access of resolving issue. Hope everyone will be aware of this tinnitus and above mention external and internal factors, and live a happy life. Thank you so much.